Here's something that might surprise you. The fastest growing group of Viagra users isn't men in their 60s struggling with diabetes or heart disease. It's healthy young men in their 20s using it recreationally at clubs and parties. And what most of them don't realize is that they're essentially playing pharmacological Russian roulette with their bodies. So why are young, healthy men reaching for a medication designed for erectile dysfunction they don't actually have? The answer lies in another drug, or usually several other drugs. Stimulants like MDMA, ecstasy, and methamphetamine commonly cause temporary erectile dysfunction. So the solution at a party becomes take Viagra to counteract that. It sounds logical, right? But here's where it gets dangerous. Both sildenafil and those party drugs are metabolized through the same pathway in the liver. They're essentially competing for the same exit door. When you flood that system with multiple substances, you get a traffic jam. Drug levels build up far higher than intended, intensifying every side effect and toxic reaction. In my years in addiction medicine, I've seen this pattern repeatedly. One substance used to offset another, creating a cascade of compounding risks that the user never anticipated. Now, let's talk about what sildenafil actually does. It dilates blood vessels to increase blood flow, which means it lowers blood pressure. In a healthy young person who already has normal or low blood pressure, this can cause fainting, dizziness, and in some cases, collapse. But here's the really frightening scenario. If someone takes sildenafil and then uses amyl nitrate, poppers, as they're commonly known, or any nitrate-based substance, you're looking at a potentially catastrophic blood pressure crash. We're talking heart attack and stroke territory in young, otherwise healthy people. This isn't theoretical. Emergency departments see these cases. A seemingly invincible 26-year-old walks in with crushing headache, flushed skin, visual disturbance, and dangerously low blood pressure, all from 2 tablets he took to enhance his performance. And it doesn't stop at the acute emergency. There are longer-term consequences we're seeing clinically. Priapism, a painful erection lasting hours, is a genuine medical emergency that can cause permanent damage. There are documented cases of vision and hearing loss, but perhaps most concerning from my perspective in addiction medicine is the psychological dependence. Young men who never needed this medication begin believing that they cannot perform without it. Their confidence becomes chemically dependent, and for some, particularly those in heavy party drug scenes, sildenafil becomes a gateway to even more extreme measures, including penile injections, which I can assure you opens up a whole world of complications nobody wants to experience. Here's your takeaway. Medicines designed to treat genuine medical conditions aren't performance enhancers for healthy bodies. They're calculated interventions with real risks. If you're young, healthy, and considering recreational Viagra, the risk-benefit calculation simply doesn't add up. I'm Dr. Fergal Armstrong. Stay curious, stay informed, and I'll see you soon on MedHeads.